In this video, we're going to be going over how to make footwear recommendations for runners. Furthermore, we're going to talk about whether cushion and pronation control actually matter. And lastly, we'll go over a step-by-step process of how to exactly choose running shoes for your patients and runners to make sure they're evidence-based and make sure they're not creating injuries. So let me summarize the most important part of this for you. And that is, we should be making running shoe decisions based on the habitual joint motion path and comfort filter. Furthermore, we should stop making recommendations based on pronation control and impact force modification. And let me tell you the reason why. For years, folks have recommended footwear based on pronation control. The idea is that a static posture or the foot posture that someone has is going to be matched up with a arch support or potentially a medial post or potentially some type of stability in the shoe to prevent pronation. Now, the problem with that is sometimes people don't even look at running and don't actually compare how the patient looks in running. Maybe they just get a weight-bearing view, maybe they get a non-weight-bearing view too, but it's highly variable. The other thing is that new research has found that pronation control doesn't actually control pronation. And unfortunately, we see that these pronation control shoes unfortunately cause some running injuries and have a high risk of problems when people are using them. So when it comes to pronation control, that is out the window. We're not using pronation control anymore to be able to recommend running shoes. And now the other side of it is the impact force modification. Now, oftentimes, folks will recommend shoes for folks that have a high impact when they're landing. Maybe they are overstriding. Maybe they have a really long step length. So the idea is that you either get them in a really cushiony shoe, a max cushion shoe, or you get them in a minimalist shoe. Now, the max cushion shoe, the idea behind it is that max cushion is going to be like a big pillow underneath your foot. It's going to land on the ground. It's going to take all that shock, and then it's going to reduce it because it's going to be more gentle. And let's be honest, max cushion shoes feel nice and plush. But the problem is we see increased leg stiffness. So that means people are running harder in these shoes and compensating for all the cushioning effects that they have in the first place. So go to the other side. What about we change impact force modification by giving someone a minimalist shoe? Well, the minimalist shoe is then going to change their running gait, most likely to a forefoot style running gait. Now, we do know forefoot strike has reduced ground reaction forces. However, if someone's not used to running that way, there's a good chance they're going to have some type of problem. Maybe a strain of the medial gastroc, maybe Achilles tendinopathy, the list goes on and on. They've changed their running gait. Not only that, they've changed it all of a sudden with one shoe and they're running every step like that. It is bound to create problems. So what do we use? You're probably thinking to yourself, well, Justin, tell me something I can use to help these patients and get runners in great shoes. Well, let's start with talking about the habitual joint motion path. That's a really good way to be able to find what patients need. Let me take you through and show you how that works. So the habitual joint motion path. What we're going to do is we're going to assess patients and get a baseline first. So we're going to observe the joint motion, the joint movement at the foot, ankle, and knees. And then we're also going to look at the hips as well. And really, we're going to be monitoring this during squatting. So barefoot squatting, feet shoulder width apart. We're going to squat down to 90 degrees 10 times. We're going to watch that patient move. This is our baseline. So our habitual joint motion path is going to be assessed by doing some squats first. Then we're going to go have the patient run. Two ways. We're going to have them run in their socks with a little pad underneath their sock is ideal so it doesn't change the biomechanics too much. However, sock running, we can call it, is one thing we're going to look at. And then we're also going to look at them running in their preferred shoes. Sometimes we'll have them run in multiple shoes, but whatever the preferred shoe that you're analyzing, have them run in that preferred shoe as well. Now we want to use the squat biomechanics as the baseline habitual motion path. Then we're going to compare that to the sock running. Now, there's high deviators and low deviators. Some folks really deviate between their biomechanics when they squat versus when they are sock running. That's a good thing to take note of. But really what we need to do is when they're running in the shoe, we want to closely monitor how they're looking, how those biomechanics shaking out. And really, we want that to mirror the squatting biomechanics. Even more, we want to rule out shoes that are deviating joint biomechanics more than the sock running. So if the sock running deviates from the squatting, well, okay, we know they're highly deviating. However, if the shoe deviates even more than the sock running, then that is a big problem. So again, we want to get shoes that are going to mimic the barefoot squat. And I should also mention here, there's practitioners and new research out there that's showing we can add some movements as our baseline. So squatting is one of them, but we also look at walking as a baseline. We're looking at descending stairs as a baseline, and we're also looking at lunges as a baseline too. That gives us more data points, that gives us more information to be able to understand how patients are moving. We compare that to the sock running, we compare that to the shoe running, and that can give you really valuable analysis of how and what a patient looks like when they're barefoot, when they're in a shoe, and that can give you a good context of whether that shoe is appropriate for them. Now, it doesn't just start there, because it's one thing to be able to take the way someone moves, the way they look in a shoe. However, comfort is really, really important. Let me introduce you to the RunCat. So the RunCat questionnaire, Running Footwear Comfort Assessment Tool, is this questionnaire that patients can go through or runners can go through, and they can basically talk about, and it's really simple here. They have the shoe there, which side it's on, the shoe that you're testing, your body mass, all that stuff. It's really easy that you could put all this in, and this was developed by some folks that were really, really important, came out of the University of South Australia. It's a really, really interesting read. If you have time for it, take a look in the references, and I'll show it to you. But when we look at the footwear here, we're going to be analyzing heel cushion, and then they rate it. No heel cushion, too much heel cushion. So honestly, and we see this, we'd want to X and make a little mark right in the middle of the cushion, because that is the ideal sweet spot for people. Forefoot cushion it gets into as well, and then we get into questions about shoe stability and forefoot flexibility. Now, lastly, we just have them rank how comfortable the shoe is, just on a subjective scale. This is all subjective, but we ask them to rate it just so we get an idea of how comfortable it is. This is the only scale that the most comfortable shoe imaginable, so all the way to the right-hand side, would be ideal. And this gives us context. When runners are assessing shoes, this gives us context. How comfortable is this shoe for them? If the shoe is not comfortable, it's not going to be good. We have proven research that shows that uncomfortable shoes cause running injuries. And also, let's be honest, who wants to run in an uncomfortable shoe? Sure, you could do it for a little while, maybe a race day, maybe for a certain event, but long term, it takes the fun out of running, right? So what do we do with all this information? Well, we know that the RunCat is going to be a little bit weighted, because what we see runners value the most is actually, believe it or not, going to be the forefoot cushion. It's not the heel cushion. The heel cushion was the least important. And then it's followed in importance from forefoot cushioning to shoe stability and then forefoot flexibility. And as I mentioned before, heel cushion is the lowest value here. So when you're ranking and looking at a patient's RunCat, take a look at where they rank these different categories, because it's good context. It may be shifted for some patients, but in this case, it's helpful to see, okay, well, they're ranking forefoot cushion to be really low, but everything else is really high. Maybe that's a consideration to take part. And here's where the clinical reasoning comes in. Because we can't just take the way someone moves, the habitual joint motion path. We can't just take that and recommend a shoe. It doesn't take into account the comfort filter. So comfort and whether the shoe is looking biomechanically sound are a great way to recommend shoes. This is a subjective and objective way we can make an evidence-based decision and guide patients towards shoes they're not only going to like, but they're also going to look good in, meaning look good biomechanics-wise, not cosmetically, of course. But at the end of the day, this is a most evidence-based way to recommend shoes. We want to toss out pronation control. We want to toss out the cushiony shoes or minimalist shoes that aren't appropriate for a patient because we're just thinking about impact force modification. Use this to recommend shoes in the future and take a look, see how your running shoes change. Do patients get different shoes than you might think, or do they get the same old shoes they've always gotten? So check it out with your patients and take care.